Here's a shout out here to my friend Druid, Anthony Druid. Intestinal cancer. The choice of the treatment to perform with sodium bicarbonate depends on two factors: the size of the mass and the depth of infiltration in the intestinal wall. In cases where the neoplasia, regardless of its shape, is all inside the intestinal lumen, L-U-M-E-N, the most effective method of attack is colonoscopy, through which it is possible to administer 150 to 200 grams of sodium bicarbonate in 2 liters of lukewarm water, going as far as the ileum caesareal valve, ILEUM-CAECAL valve. Maybe you'll have to find somebody who can do colonics to get it super accurate. Even when the masses regress conspicuously within a few days, it is best to program from 7 to 9 sessions for a period of 3 to 4 weeks, keeping in mind that the first ones must be close together to have an immediate effect, and that the last ones are for the purpose of consolidation. The possible crossing beyond the intestinal wall or the simultaneous presence of a hepatic metastasis imposes a specific therapy for these organs as well. I think that means liver, but I don't think that's your case yet. Temporary episodes of diarrhea can take place during or after each session with bicarbonate salts, but this is not a reason to interrupt the therapy. At most, it may be appropriate to pause for some days. Under a certain size, that is, if the tumor has not completely invaded the intestinal lumen to the point of subocclusion or occlusion, the endoscopic treatment turns out to be very efficacious for obtaining regression of the masses. Where instead there is an extreme situation or the simultaneous presence of another synchronous tumor, that is, existing in other sections of the intestine, and where it would be very difficult to reach after passing the first mass, then surgical intervention is indicated in such cases, as it saves the performance of the canal down to the anus. So I guess it means you don't go for the one that's closest to the anus, you have to go beyond that, and so you have to take out the mass in order to get to the one beyond that so that you can have a tube that's going from the canal down to the anus. This is possible through terminal or lateral anastomosis, A-N-A-S-T-O-M-O-S-I-S. Anastomosis, undoubtedly a Greek word, I don't know what it means. Lateral anastomosis of the resected stumps, both treated later in the surgical theater and through post-surgical draining with local and regional administration of sodium bicarbonate capable of preventing the formation of possible local or hepatic relapses. When the tissues are more vulnerable in the critical points, C-I-C-A-T-R-I-C-I-A-L points, where reactivity equals 0, I guess it's when your immune system has been flattened, or at the hepatic level because of the toxic effects of the anesthesia, treatment with bicarbonate prevents that fungin regermination that most of the time causes a return of the disease and is impossible to cure. The indications for prevention in this case are the same as those for the therapy of peritoneal carcinosis. And that's where you're bathing the abdomen with bicarbonate of soda. I don't think I read that far last time. Okay, so this is in hopes that somebody, before they have surgery, can give bicarbonate of soda a shot. You've got 1 day, and you should be able to see results in 1 day. Just get about, what did he say, 1 or 2 liters of warm water and put in it, I think, 200 to 300 cc's of, let me see what you say, of bicarbonate of soda, and then just get it up your butt. And figure out some way to get it up your butt. You can get a turkey baster to do that. I mean, a colon therapist would be great. But he's saying you've got to go as high as where the where the tumor is, because that's what you're trying to do. It's a invasion of fungus, and so you want to treat it that way. 150 to 200 grams of sodium bicarbonate in 2 liters of lukewarm water, going as far as the ilium K-cell valve. So I wish I had Simoncini here in my back pocket. I don't, but I think it's important to put down the weed. This is not a time to be getting high or be getting drunk. This is a time to be very attentive and alert.